Hi, my name is Heather Willison. I'm a nurse practitioner with Parkview Allergy, Asthma, and Immunology. And today we're going to talk about how to treat a sting from a bee, wasp, or hornet. If you are stung by an insect, whether it's a bee, wasp, or hornet, you are going to feel pain immediately at the site, of course. And then there's also going to be swelling and redness and some itching. First of all, if you are stung, you do not want to run and flail around. Calmly remove yourself from the area so that you don't aggravate the stinging insect further. Then you want to examine the site where you were stung. If it was a bee, bees leave behind stingers. You don't want to use tweezers to pull a stinger out if it's a bee sting, because that's just going to cause the venom to inject further into the skin and cause more of a reaction. And you also don't want to scratch at the site. So in order to remove the stinger, you're going to want to use either a credit card, something that has like a flat, hard surface. You can use a fingernail, but you want to make sure your hands are clean. Or you can also just use a piece of gauze so that you can remove that carefully. After the stinger is removed, you're going to want to wash the area with warm soapy water, pat it dry. You're going to want to apply ice for comfort and to reduce the swelling. You might also want to reach for an anti-itch cream, such as like an over-the-counter hydrocortisone cream. They also have sprays of diphenhydramine that you can spray on the site that can help with itching. And then of course there's calamine lotion that you can find as well. If it's an arm or a leg, you might want to elevate that area to help reduce the swelling. And sometimes for the discomfort, you can take over-the-counter ibuprofen or acetaminophen. You can also take an over-the-counter antihistamine such as diphenhydramine to help with that. You don't want to get too concerned about the swelling initially because that's common and normal. However, that swelling will tend to possibly increase over the next 48 hours and then is gone completely, typically by about day 7. There are about 2 million Americans who are allergic to insect stings. So if you start to experience difficulty breathing, swelling in your mouth, like your tongue or your throat, if you develop hives, nausea, dizziness, feel like you're gonna pass out, those are all signs of a severe allergic reaction, and you should seek emergency attention immediately. Now, of course, there are people who already know that they're allergic to these insects, and those people should be carrying injectable epinephrine. This is a trainer for an EpiPen, and this is a trainer for Auvi-Q. If you have to use one of those devices, you do need to seek emergency attention immediately. So you might ask, how can you avoid being stung by an insect this season? Insects, particularly stinging insects, are very attracted to bright colored clothing, floral clothing, and anything that has a strong scent like perfumes and colognes. You also want to make sure that if you're at a picnic per se, you don't want to be outside with open food for very long or open containers such as open pop cans or glasses of lemonade at a lemonade stand. The other thing that you can do in picnics in parks or even at home is make sure that trash cans are well covered, the lids are on there tight so that bees aren't attracted to any leftover food or discarded sticky glassware. Hornets are a different kind of breed because they actually make their nests in the ground, so you want to wear shoes when you're walking out in the yard. So just beware of where you can find stinging insects this summer. For instance, bees live in hives made of honeycombs. Hornets make their nests in the ground, and wasps tend to make their homes on the sides of buildings or hanging from trees. Hopefully these tips and tricks help you enjoy your summer. Be safe.